Welcome to the Canadian Bariatric Clinic, the obesity and cardiovascular treatment and research center located at JBN Medical in Burlington, Ontario. Bariatrics is a relatively new word. It is derived from the Greek word baro, meaning weight or pressure, like barometric pressure. Bariatrics involves the treatment and research of obesity. Obesity affects 65% of adult men and 53% of women in Canada and is associated with increasing health risks, including cardiovascular disease and type 2 diabetes. Obesity is a multifaceted, complex disorder. There are many causes for obesity, yet the primary driving factors are genetics and the environment. Neurochemicals, or brain chemicals and hormones, are essential for weight preservation and can become overexpressed and result in excess weight. The overexpression of these hormones is primarily driven by poor lifestyle choices and incorrect diets. Many of these diets are commercial diets. Since the primary cause of obesity is genetics and the environment, it is often difficult, if not impossible, to treat obesity using cognitive willpower to change eating habits. The use of appropriate meal plans, muscle building and exercise, medications, surgery, and cognitive behavioral therapy is necessary to treat and prevent this complex disorder. The Canadian Bariatric Clinic has incorporated a multidisciplinary team of physicians, technicians, exercise specialists, social workers, dietitians, and administrators who understand the complexity of obesity. With regular follow-ups and multi-therapeutic interventions, we aim to deliver effective and long-lasting medical care for obese and overweight patients, improving all aspects of their physical and mental health. Let me walk you through a typical visit to the Canadian Bariatric Clinic. On your first visit to the CBC, you will be required to fill out a medical history questionnaire. This should only take a few minutes. We will ask you watch this video in completion prior to seeing the technician. The technician will then see you in our bariatric assessment room and will take the necessary measurements, including weight, height, Tanita scale body composition analysis, waist circumference, and metabolic rate assessments. This data will be used by the bariatric physician. Your first visit with the physician, you will have a physical examination. Bariatric patients often have abdominal hernias and skin infections that are not treated. Baseline tests will be ordered, including cardiovascular testing, endurance tests, blood work, and abdominal ultrasounds to assess for liver and biliary problems. We will repeat some of these tests within the year to assess your progress. We will ask you to complete a 1-week food diary. The food diary is a list of all the food you have eaten during the day. We will ask you to try to assess the number of calories in each item. Calorie and protein counting is an essential tool in weight management. We recommend that you use one of the following tools to help you to count calories. 1. The food label. 2. A calorie assessment website. 3. A calorie counting book. And 4. The most accurate method is to use a nutritional assessment food scale. This scale will be further demonstrated later in this video. Your bariatric prescription of health will be given to you at your second visit. This will include a meal plan that is specific to your needs. We encourage patients to have visits every 2 to 4 weeks. At each of these subsequent visits to the CBC, the physician or nurse clinician will refine your treatment plan. The CBC offers many services. Some of these services are covered by OHIP, some are not, but they may be covered by your private insurance plan. Here is a list of some of the OHIP covered services: MD visits, diagnostic test, including echocardiogram, ECGs, exercise stress tests, and spirometry. The CBC offers a lecture series that occurs approximately every 2 weeks. All of these lectures are free. Lecture topics include childhood obesity, bariatric surgery, and how to eat properly. All patients are required to attend the introductory lecture and are highly encouraged to attend all other lectures. Family members and the general public are invited. Please RSVP on our website at thecanadianbariatricclinic.com or inform the front desk staff here at the CBC. The following services have variable fees, as they are not covered by OHIP: dietitian, social worker, and kinesiologist visits, calorimeter testing, and the OptiFast program. The CBC has been designed to accommodate multiple patients and offer a high level of care. We believe that you will see results from your visits at the Canadian Bariatric Clinic. For more information on the Canadian Bariatric Clinic, please visit our website, CanadianBariatricClinic.com. The website will allow you to view all CBC events and lecture schedules and much more.